Hi, today is Tuesday, April 21st, 22nd, 2025. So since I don't have enough time before I start the work at 9 o'clock, I'll just go ahead and read without any gibberish, without prelude. This article is from Vital News, and the website is topwatchmart.com. By the way, I am trying to read this article to practice English by reading it aloud, to learn English by reading on English material of 20 minutes to 40 minutes length on a daily basis. So it's a purely academic effort on my part. The title is Life After Gallbladder Removal, What to Expect. The gallbladder, I have a gallbladder stones, right? Gallstones. So I'm just curious about what would happen if I have to remove them. I don't want to remove them, right? The gallbladder, a small pear-shaped organ located beneath the liver, plays a significant role in digestion. It stores bile, a fluid that helps break down fats and releases it into the small intestine when we eat. However, for those dealing with painful gallstones or gallbladder disease, removal of the gallbladder is often the best solution. But what happens to the body after this surgery? Before diving into the effects of the gallbladder removal, it's essential to understand the common problems that can occur within this organ. Gallstones, cholecystitis, inflammation of the gallbladder, gallstone pancreatitis, and gallbladder cancer are some of the tissue issues that can arise. Symptoms of gallbladder problems include upper right abdominal pain, nausea, vomiting, fever, and jaundice. I don't have anything of them. Any of the symptoms. Any gallbladder removal, the liver still produces bile, but it drips continuously into the digestive tract instead of being stored. For most people, this change isn't a significant issue, and the digestion continues as usual. However, some individuals may experience temporary digestive problems, particularly in the first few weeks after surgery. High-fat meals may cause discomfort, and some people may experience bile acid, diarrhea, or bloating and gas, flatulence. Dietary adjustments. To ease digestion, it's recommended to eat smaller meals, focus on lean proteins, whole grains, and fiber-rich foods. Avoid fatty foods, fried foods, and sugary treats. And that can also help. Staying hydrated is crucial, especially for those experiencing diarrhea. Drinking water, herbal teas, or electrolyte-rich broths can help replenish lost fluids and minerals. Recovery tips. Experts recommend starting with a light diet or clear liquids and bland foods before gradually reinforcing solid meals. Limiting portion sizes and making healthier choices can help maintain a balanced weight. While there is no strict post-surgery diet, following these tips can improve digestion and aid in recovery. Yeah, limiting portion sizes, right? It's important. I consume a lot of portions, right? One spoonful could be enough, but sometimes I drink or eat 3 spoonfuls of foods. The good news, Most people lead completely normal, healthy lives without a gallbladder. While digestion might feel a little different at first, the body is incredibly adaptable, and within a few months, you will likely feel just as good, if not better, than before. With some simple dietary adjustments and mindful eating, you can enjoy a healthy and comfortable life after gallbladder removal. Yeah, a lot of racy scenes in the videos, right? Quite racy and sexual and explicit. Is that it? That's it? Oh man. That's, I don't know, it's rather short and so dietary regimens, good news. Healthy, comfortable life. So there's nothing to worry about except that we need to decrease the food size, right? Portion sizes. And we should avoid a high-fat diet. Instead, we should focus on the protein, broth, some fluidy food, because we will have some kind of a diarrhea sometimes. But in Asian medicine, in the traditional Korean medicine, we say gallbladder is removed, then your decision making becomes weak, right? You cannot have a firm decision in your life. You just feel like sometimes you should go to path A, sometimes path B, and you reverse it and you choose to go to path A, right? Your decision making is shaken. You have firm, unfirm, fluid decision process within your mindset. So always don't remove your gallbladder until it just pain is unbearable. Well, that's what I'm going to do. I have 6 gallstones of 6 millimeter in size so far, so that's nothing, right? I hope there isn't any problem. The reason I had gallbladder stones or gallstones is that about 25 years ago, I drank special alcohol that was fermented among the germanium stones, right? Yeah, I just drank the like a 1 bottle of, well, 2 bottles of Pepsi Cola or 2 cans of Budweiser, right? Same size, and the portion, the alcohol was not fermented well, and I think it contained some ethanol instead of methanol, right? The usual alcohol, it was not a usual alcohol, and I drank it from the quack doctors, and it was no good. So it produced the gallstones, and there were some dark spots on my upper hands, right? Fingers. So it was no good. So that's why I developed gallstones. Be careful. Just try to go for a plant-based diet. Thanks for listening. Have a wonderful Tuesday. Bye-bye.